On today's podcast, we're going to be talking about an idea that has become a hot topic in recent years: a guaranteed basic income. My guest will be Senator Kim Pate. Pate has a bill in the Senate that, if it passes, would require the government to draw up plans to implement a basic income for Canadian adults. This idea has a lot of supporters who have argued that it would cut poverty. It has plenty of skeptics as well. Who would get the cash handed out under such a program? How much would they get? And how could a government possibly afford it? These are some of the questions that I'm going to ask Senator Pate. That interview is coming up after the break. Okay, we're back with Senator Kim Pate. Senator, welcome to the Hot Room.
Thank you very much, Peter.
Let's start with the basics. Your bill is numbered S233. It is titled An Act to Develop a National Framework for a Guaranteed Basic Livable Income. It is not a government bill, which means that first, it can't actually force the government directly to spend any money, and that there is no guarantee it will pass into law or even make it to a final vote in Parliament. Right now, your bill is being studied by a Senate committee. So, with that out of the way, what would your bill actually do or require if it is passed?
Well, that's a great question, and you're absolutely right. It's the bill would basically propose the development of a framework. Would require the government to have consultations with the provincial, territorial, municipal, as well as Indigenous governance bodies, with the whole idea of looking at how we could create a basic income, a livable basic income that would be a more cost-effective response to the current issues that we're seeing, whether it's the climate issues, whether it's the pandemic, whether it's the very many social, economic, and health and environmental insecurity issues that we're facing in this country that give rise to the need for people to have incomes.
So let's talk about this basic income that you have in mind. How much money and who gets it?
Well, that's part of why we want to have the consultations, because we know that what you need to live on in downtown Toronto or downtown Vancouver, where the cost of living is very high, can be very different from what you need in rural PEI, for instance. And so the reason for the consultations would be to discuss how to roll this out in a way that might save administrative costs by rolling funds together, but would allow for regional differences based on family composition, as well as cost of living. And so those are very much some of the consultations. So we know that during the pandemic, the government said that with the emergency response benefit, people needed at least $2,000. There was nowhere in this country that people are provided with that amount of money on social assistance, for example. So looking at what would actually be livable, what would actually make it so that people could not just barely survive or stay entrenched in poverty, but how we could actually provide a framework that would allow for people to rebound out of situations when they can't work, when they're suddenly ill, when they need to take care of other people, or when they're trying to train or get education or other kinds of opportunities to get better jobs. Those are all the kinds of situations we're thinking of, and that where income supports are provided right now.
So you mentioned the example, I think, of the CERB that was handed out during the pandemic. That was only supposed to go to people who were laid off because of the pandemic. If the government started giving out that amount of money to every adult in the country every month, it would cost hundreds of billions of dollars every year, which I don't think I'm going out on a limb and saying that that's not realistic. Is that what you had in mind?
No, not at all. No, we're talking about an income tested model. So it would be, again, depending on what the cost of living is, what the inflation rates are throughout the country, it could be tailored to regions. And what we know is the Revenue Canada stream was the only stream fit for purpose to roll benefits out. It could be, given that the government has said they want to bring online more people who aren't currently filing taxes or don't actually, they don't pay taxes because they don't owe any money, but they also don't get benefits they could be entitled to, that we would see this as combined with potentially the onboarding of people that the government already plans to do in terms of bringing people on the system. It could be deft enough that it could respond to monthly changes, and it could be something then could roll out and could combine and actually do away with the siloed approaches that now happen by provinces, municipalities, through EI, through all of these. Potentially, it could roll those together and have the administration come under the income administration come under one area, or one administration, and then allow for benefits be part of the thread, the fabric of our social, economic, and health safety net in this country, and free up resources to actually allow people to do the work they want to do. So when I talk to social workers who right now their main job is policing people's incomes on social assistance, they don't often have the time to do the kinds of work that they went to school to do, that they want to do, which is assist people, whether it's to deal with, other issues, whether it's mental health, whether it's addictions, whether it's how to get retraining, how to get access to better supports, how to plan for their future, how to assist their kids, all of those sorts of areas. We could be freeing up the people that currently spend most of their time administering those incomes to actually provide the support services that people need. So that's more what we're talking about. And that in some areas, it may be more than 2,000 because of the cost of living, because of the needs, because people may have disabilities, they may have other accessibility issues. And certainly the government is looking at that right now through the disability benefit. We have a whole series of these kinds of benefits that currently are income tested and could be modeled in the same way. So we have the Canada Child Benefit, we have the guarantee for families with children, we have the guaranteed income supplement for seniors to lift those who are, even with CPP, are still living in poverty, to lift them out of poverty. The disability benefit is anticipated to do much the same. And so we keep creating these types of guaranteed livable or basic incomes that are income tested, but we're not, we're keep creating them all over. We also saw that part of the reason we needed the CERB was the employment insurance system was not fit for purpose and couldn't address the issues that suddenly came up because of the pandemic for workers who couldn't work. So I think there are ways that we could look at all of those systems, and I think the bringing all of those folks together to say, how could we streamline this process so that the more than $80 billion a year we're spending now on poverty that keeps people in poverty instead would assist people to get out of poverty. And we know from the costing that's been done on, whether it's the University of Saskatchewan that's done some of the costing, whether it's the cash transfers, that they're estimating that the social return on investment is 106%, that we actually stimulate the economy and we see cost savings ultimately, not just in terms of social services, but also in terms of other areas like healthcare and, reduced criminal legal system costs, that sort of thing. And people spend their money in the, if people who get money who are trying to survive in the community spend that money in the community. So we're not talking about a grant that goes to everybody. We're not talking about an amount. We could look at the census model for families so that, one of the criticisms with CERB was there were some adult children who stayed home who benefited from getting a benefit when in fact they didn't really have the same need as, someone with a family who was suddenly laid off and that was the only source of income. So we could do things like use the census family as a model so that you're not providing those sorts of mechanisms for people to benefit where in fact there isn't a need. So we're talking about an income tested model, not something that is designed to just give money to people who don't need it.
And so when you say income tested, the idea there is, like many other government programs, if you have zero income, you get the whole thing. If you have a lot of income, you get none of it. And there's sort of a sliding scale in between.
Yeah, I mean, I have lots of ideas about this. Part of why I'm trying not to be too prescriptive is part of the reason of having a framework legislation is yes, we can't spend money, and I have some ideas about what I think would work. But I also think we do need to consult with the people who are now administering those services and say, what is it that would be, how could we best do this? And I know in the Ontario pilot with the basic income pilot, they did instead of having a full clawback for anybody who made money, they created incentives to work by clawbacks being gradual so that it might be 50 cents on the dollar, it might be 25 cents on the dollar for the first couple of $100, it could be 50 cents. And so it's a gradual clawback that actually produces an incentive to work because our biggest disincentives to work right now, in my humble opinion, in this country are our social assistance schemes. Because if you start working and you make, in some cases, work as few as 100 hours or 20 hours and make as little as $200, you start to see clawbacks. And we saw during the pandemic that some provinces clawed back benefits for people who got CERB, who were suddenly, had been working, were then on assistance and were claiming the CERB. And instead of being able to use that to help survive, it was clawed back. And so it was actually became also a cash grab for some of the provinces and territories. So we're really trying to make this something where the money gets to the people who need it, so that they can then use it to buy the services they need, whether it's housing, clothing, food, um, and basically get a leg up and out of poverty.
You mentioned social assistance. Some people might know that by the phrase, the term welfare. How would this, I mean, we have social assistance, as you mentioned. How would this be any different?
Well, the difference now is it's administered province by province and territory by territory. Um, it's often characterized, in fact, in about 3 decades ago, there was a real push to talk about social assistance as having to be an incentive to work. But in fact, it proved to be quite a disincentive to work because as when I was visiting some of the communities in the north, I had elders saying to me things like, we want to start a program. We want to start, in that case, they were looking at an ecotourism initiative. They wanted to start taking tourists out on the land, camping, seeing the aurora, doing things like that. But they couldn't take the young people because the young people had to stay in town or in their community looking for non-existent jobs. Because if they went out doing this, even though they wouldn't be paid, they would not be available for work if it suddenly miraculously appeared out of nowhere. So those kinds, unintended consequences of the ways those programs have been developed is, in fact, they create the disincentives to work. Because the other thing that happens is if you start to work, in some cases you lose your benefits in terms of a drug plan, and like a pharmacare program or your dental program, and those become disincentives because people who are not making enough to buy food, let alone buy the drugs they may need for preventative reasons, whether it's because of heart issues or diabetes or the like, then aren't able to. And we know also that it increases mental health issues. And certainly Dr. Zhao, who's been doing the cash transfer programs in Vancouver, also talks about the ways that it actually inhibits not just brain development, but your ability to think and plan to move out of the situation, this poverty of lack of work that you're in. So, there are all kinds of benefits to this, but really, I think it does involve us really facing the reality that right now, the many of the critiques that have been brought to bear on basic income programs actually are the critiques we have and should be examining with respect to our social assistance or our welfare schemes throughout the country. And they were welfare schemes when they were developed. They're not anymore. They're mostly programs that actually keep people stuck in poverty.
So we're not talking about free money for everyone. We're talking, and correct me if I'm wrong here, basically about taking the social assistance programs for poverty that provinces administer and getting the federal government to administer them better, ideally, instead. Is that right?
Well, some people are proposing that. I think that may be a more effective administratively way to do it, but some folks think that we should top up those programs. So there would be a program across the country that would top those up with an agreement that the provinces wouldn't claw them back. Personally, I think we should look at streamlining all of that administration. Currently, it's the responsibility of provinces to administer. There could be an agreement because, tax dollars are used in both ways, federal and provincial or territorial tax dollars. And part of the reason municipalities are coming on board, of course, is when the provinces don't meet their obligations for people, the results we see in our streets. We're seeing it now in terms of the tent cities, the numbers of homeless people, numbers of people with mental health issues. And so those responsibilities that are provincial, we could talk about how do we strengthen that social, economic, and health safety net. And one of the ways could be streamlining the administration of things like the income supports and freeing up the provision of services to be and continue to be administered by province and territories. That's one idea. Part of the reason for the framework legislation is to say, but let's talk about it and see, is there a better way? I don't presume that the work that we've done a lot of work with a number of economists, with a lot of folks who have looked at these issues for years. I don't presume that that's the only way. And certainly my interest personally is in seeing what's the best option for the greatest number of people to lift people out of poverty.
So let's talk about how to pay for it. Because any new programming that the federal government implements is going to be paid for with borrowed money. Some people are fine with the government borrowing more money. This year, according to the Fall Economic Statement, the government is going to spend $46 billion just paying the interest on the federal debt. And that is projected to climb to $60 billion within a few years. So that is the cost of the debt we're carrying now. Any more debt we take on to pay for programs like this is going to shrink the budget for spending on other stuff. So how do we pay for it?
Well, we asked the parliamentary budget officer to cost it because that was, of course, one of the big issues is how do we pay for it? And many people have focused on the gross costs versus the net costs. So it's important to look at those. So the gross cost that the parliamentary budget officer found was somewhere in the neighborhood of $85 billion. The net cost, though, could be as low as $3 billion. And that doesn't take into account cost savings, nor does it take into account the social return on investment. So some have estimated that the cost will be upfront for possibly the first few years, but that the cost savings will come as early as 4 or 5 years down the stream. Now, part of the reason politically people have not signed on is the obvious reality is elected politicians are in for the electoral period. And so the cost savings may not show up until the next electoral period, which is part of the disincentive for elected politicians to get on board with this. But part of the reason that it's gaining such support and has been something that's been looked at since the 1970s by all political parties, including the Conservatives, because long term, it's just like Medicare. People know there will be a benefit to the population as a whole, to us individually, but also to the population as a whole. So the big hurdle is getting over that initial investment of what looks like probably around $3 billion net. Now, my colleagues who do work on tax evasion, like Senator Down, and the work on how we look at hidden monies right now, like taxes that aren't paid and taxes that get hidden, is that we could be looking at the difference between what is collected in taxes versus what should be being collected, the tax gap. And that is multiple billions of dollars, tens of billions, and it's estimated as anywhere even over $100 billion. So when we talk, we're not talking about new money. We're talking about more fair distribution of resources, really, and really determining how do we actually use tax dollars now to better support everybody and not just allow those with the most to continue to accumulate more and more wealth and store it offshore, evade taxes, but really invested in our economy here at home. And again, I think it's important to remind folks that we, currently spend more than $80 billion a year keeping people in poverty. This would be an investment to help people get out of poverty. So we don't even know how positive the long-term savings could be. Certainly in Manitoba, they saw a decrease in healthcare costs. They saw a decrease in criminal legal costs. And we're told that even though the Ontario pilot didn't finish, they were already starting to see benefits like that of people getting work. The cash transfer program in Vancouver, they've seen a savings of about $1,000 per year in just the services that are provided. So we know there are savings. We don't know the extent of it, and partly because we haven't allowed it to unfold here in Canada. PEI wants to start. I think we should, at the very least, start with PEI and see what unfolds there. And if people want to then say, we'll wait until PEI is done, we could still continue the discussions about how this rolls out across the country, because I actually do believe that, like Medicare, where it was Saskatchewan started it, once it started, every province and territory wanted to participate because the benefits were clear. And while we need to, improve those systems now, and we've seen the deficits in how much we have eviscerated healthcare over the past couple of decades, nobody is game to roll back Medicare across the board.
So, $80 billion gross cost a year. I'm going to ask you about the savings in a minute, but just so we have an idea, because all the money comes from the same taxpayer, would that be 80 billion while we're also paying taxes towards provincial programs too? Or would that be if the feds uploaded the whole thing from the provinces?
Well, I think it could be a combination, either of those or a combination. But remember, we're already spending that on poverty right now. So it would be a reallocation potentially of the resources.
Yeah, I mean, that's what I'm asking. Are we going to continue spending that on poverty and then spend this too?
Oh, my hope would be no. Absolutely not. It's not, if I could make the decisions, that would be the bill we'd be introducing. But this is a framework piece of legislation to say, let's have this discussion. Let's determine how best to move forward on this and use the monies that we're already expending to keep people in poverty to actually, as best we can extricate and provide opportunities from the rebound for them to rebound out of that, whether it's because they're suddenly having to be evacuated because of fires, whether it's because of a pandemic, whether it's because of mental health issues, whether it's because of AI and changes in what jobs are available. Let's have something that's agile enough to meet those needs and address and assist Canadians.
So, gross cost of 80 billion a year, net cost you said of 3. How do you get from one to the other?
Well, it would be by taking some of these programs and combining them and streamlining them, and basically rolling them together, as well as having some agreement, federal, provincial, territorial agreements about how to do that. So it would involve those discussions that the bill presumes will happen in order to develop that framework, and then a rolling out of the initiative. And the net additional cost would likely be because, to change that process does require time, and it will require some extra investment of resources to get us there.
We spend about $20 billion a year on employment insurance. I know you mentioned that before. Would that be one of these? Is that part of the calculation, rolling the EI program potentially into this?
It's potential. I wouldn't rule out any potential to roll the programs together, not to cut people off, though. Some people have one of the conspiracy theories I heard during the pandemic was that this was an attempt to try and take monies and benefits away from people. Absolutely not. I have spent my life trying to support people to have what they need to survive so that they don't end up on the streets or dead or living in, horrendous circumstances. So it wouldn't be to take benefits away. It would be potentially, though, to streamline the economics of those benefits and potentially roll them together. But of course, we still need part of the other part of employment insurance is trades training and other supports that go along with that. Those require people to do it. And what I think would be a better investment of the actual resources is to put those monies into one program that could roll out the financial component and free up all those folks to actually provide the supports, and to ensure that people have what they need, not just, if this wouldn't just be a cash program, it would be streamlining that component to free up resources to provide the other supports that people need that too often they don't get right now.
You've said several times right now we spend money to keep people in poverty. How so, and how should we do it differently?
Well, right now, there is nowhere in this country where the amount of social assistance provided to people is sufficient to allow them to live. And it creates a situation where people are having to try and, well, we know food bank use is up. We've never seen food bank use as high as it is right now. And so we know how many people are homeless. And so we know that people aren't managing to stay afloat with what's provided now. And so right now we are actually keeping people in those situations. And if they do work, they either have to do something for which they could be penalized. They either work under the table, do, cash or barters or that sort of thing, all of which by the policies aren't allowed, but are necessary for people to survive. And so we're creating what I call infinitely criminalizable groups just because you're poor and you can't manage. And I think that is wrong. And if anything's criminal, that's criminal. We shouldn't be setting up policies that set people up to be in situations when all they're trying to do is survive increasingly inhospitable and economic and social and health and environments. And so that's really part of what we're trying to do. That to say, let's deal with that. Let's ensure that people have what they need and that we can the people that we're training to do social work, psychology, to provide supports, that they can actually do that they're not spending their time administering income supports, judging whether someone deserves to get an extra $5 for their, for a bus pass or bus tickets, or, to be able to go to the food bank to get the money that they're now dealing with because they're food insecure, because they don't have enough money to deal with it. In most parts of the country, you're dealing with people getting a food allowance on social assistance than is less than many people pay for their morning coffee if they buy it and on their way to work. So, those are realities that oftentimes when I talk about the amount people receive on social assistance with some of my colleagues, they're incredulous. And so we have to bring and show them, look, this is how much people are making. And there's a reason that we see the jails full of people who are impoverished. It's not necessarily because they pose a great risk to our public safety. But certainly, when you have 80% of the women serving sentences for fraud-related offenses, you have to put two and two together here. And so really we need to address this issue, for the benefit of all of us, I would say.
So we only have a few minutes left, but I want to get to the tough part when it comes to designing a policy like this. You want to give people enough money that they can actually live. But if you give them an amount and you design the clawbacks in such a way that they can earn more through that system than they would working a minimum wage job, or they can combine the two, be on government assistance and working a minimum wage job and make more than they would otherwise, that creates a lot of weird incentives. If you're an employer, why would you ever give anyone a raise? If you're an employee, why wouldn't you do both at once? How do you create the right sets of incentives so that people can live, but they actually benefit from working?
Mm-hmm. It's a great question, because during CERB, we know I heard of examples of employers urging their employees to go get CERB and asking if they would stay and volunteer, and they would get top-ups while they worked to enable them to keep their doors open. And and people did that apparently. And so those are real issues. And I think part of what goes hand in hand with this absolutely is, we need to ensure that there are other issues taken care of, like wages and benefits. And I think it is a problem that, when I was at the homeless shelter during the height of the pandemic, there was a woman living there who was working full time, minimum wage job, and because she got no benefits, and because she could no longer work the 3 jobs she was working before the pandemic, because she worked in care homes, she was living in a shelter. And so we need to also, when I say this is just one thread of the social safety net, we also need to be looking at the other ways in which we have abandoned folks, whether it's through rent controls, whether it's through, requiring benefits and supports, the fact that we provided wage subsidies to businesses, but then didn't expect didn't question when they were paying out dividends to shareholders, I think is a problem. I think we do have to look at those areas as well. So it is an area where, again, why I keep coming back to, it involves the discussions of all of these governance bodies to say, what are the threads that we shouldn't let go, that we need to keep hold of and say, yes, we're doing this. And we also need to look at other ways, whether it's regulations around some of these areas, around wages, around benefits, around rent controls. And certainly we're seeing it in terms of the overall homelessness issue now. There are all kinds of issues around creating housing, but still leaving it unaffordable. And how do we actually create the circumstances that don't just benefit those who have the most? And we have been on a track where we have, not paid as much attention, I would argue, to the folks who need the resources, and have ignored the folks who get away with making many, many millions and billions of dollars, as happened during this pandemic, without contributing to our tax base in the way that their share of the tax base. And so I would see where we do the tax work and the tax equality work would be on addressing those very high income areas where people are avoiding paying taxes. And as Art Eggleton said to me once, part of the reason he and I and many don't support the UBI type of model, the universal basic income, where a grant goes out to everybody, is, as he said, when he did help people do their taxes, he was paid to help rich people not pay taxes. And so we're talking about resources going to those who need it, those who will contribute to our economy, not take the money out of the country and avoid paying taxes.
Well, we'll have to leave it there. Senator, good luck to you as the committee scrutinizes your bill, and you've given us a lot to think about.
Thank you, Peter, and thanks for all of your work.